Today we're going to be working on assessment and possible treatment at the knee. We're going to use the motion guidance medium strap, flat mount, and the ball and socket laser. This is a pull-through strap. We can apply at the knee, pulling it around firmly, and the patient can move it toward the front of the knee with the blue field. We can slide on the motion guidance flat mount into the blue field and secure it. Standardizing can be done by the same distance at the suprapatellar area to the belt by using a phalanx distance or an actual measure. Then we can apply the ball and socket laser from the side and twist on in front. Push button to turn on, and we can have the patient approach the motion guidance flag. Turning the laser on, we can project it out in front of the great toe. The first thing we'll work on here is assessing combined hip and knee flexion activities in single leg stance. So Jess, I'm going to have you lift your right leg, bring the laser up toward the target for assessment of functional range of motion and tolerance. Can you lift that above the target? You have enough motion for that. Wonderful. Okay, we can also work on a terminal knee extension by having her do a quad set and pulling that laser toward her toes. Adjusting the laser onto the foot, we can cue the patient to bring the laser onto their laces after they tighten the quad. Great. Moving on to squat assessment, we can have the patient take their midline and line it up with the midline of the flag. We'll project the laser out over the great toe and take a look at squat assessment. From this position, if the laser projects out onto the wall, we look typically for a nice depth squat. If the laser was to project short and stay on the flag, it might be a knee forward squat or a poor biomechanical squat based on the demands of squat performance. Working on motor control during a bilateral squat, we can have the patient squat down and project the laser out onto one of our grid lines. Keeping the laser on the grid line, we can have her move the laser toward the right and then come back and move the laser toward the left and come back and then return from the squat. We can do that at multiple grid lines for assessment of potential involvement at different angles at the hip, knee, and ankle complex. We can also work on complex movement patterns for motor control. We can go into single leg stance and move the right leg through the arcing patterns on our flag in multiple planes of motion. We can use large arcs or work on small arc patterns using this motion guidance flag. Great. For single leg squat progressions, we can go into a lunge with the right foot forward. Make laser adjustments, keep her on the line, and perform a step back lunge slowly for me, Jess. We can make determinations on precision, depth of the lunge, variations in aberrant movement, or poor control. Another progression can be a lateral lunge, stepping to your left side, back up, looking for the same consistencies or aberrant movements. Great. How about attempting some pistol squats? commonly see increased challenges with single leg activities. The most common being drops across the midline into what might be considered valgus. Back up and rest. Working on precision is also an option here. How far can they keep the laser on a certain line on our grid system without deviating from that pattern? Let's try some knee excursions. So let's come out and do toe taps at this dot, the left side, and then a lateral toe tap and a toe tap behind you, mimicking a Y balance type of exercise. Great.